Hello, everyone. Marsha and I are excited to share with you our presentation on a project that has focused on the development of a module on addressing social determinants of health with an interprofessional approach. In June of last year, an interprofessional group of faculty from our colleges began meeting on a weekly basis to brainstorm different types of preparatory and high-level education that we can provide to students participating in any interprofessional clinical outreach activities, such as the Unity Clinic, where many of the patients are from vulnerable populations. As we all know, social determinants of health significantly affect the health outcomes of vulnerable patient populations, as shown in the graphic on this slide. So it became important to us to at least introduce this concept to students and increase their understanding that providing care for patients goes beyond the four walls of a clinical setting. For example, do some patients face barriers in accessing healthy food options? How does that relate to their ability to maintain a healthy diet? And what can health professionals do to address those barriers? And lastly, how can interprofessional collaboration help address social determinants of health? So we developed and launched a 3-part training module with an interprofessional lens. The module consists of an interactive simulation, a webinar, and assessment, and an in-person debrief. Most of it is provided through D2L and part of it in person. Our goal with this module were to not only introduce social determinants of health concepts to students, but also, 1, ensure that every profession feels empowered to step in and be an advocate, and 2, prepare them to recognize determinants at Unity Clinic and address them to the best of their ability. We would like to emphasize that this module is only intended to supplement the training of OUHSC students and provide them with a better understanding of social determinants of health and how each one may influence the health of individuals and communities. It is not intended to replace other social determinants of health courses in the different colleges. Our learning objectives for this module included the following listed on this slide. We hope that the module encourages students to explore how each member of the healthcare team can be involved in helping patients with any identified barriers and thus optimize their delivery of care. This module will also enable learners to enhance their cultural humility related to social determinants and develop a better understanding of the various challenges that patients may face while trying to access care, hopefully resulting into improved communications between patients, providers, and all members of the healthcare team. The interactive simulation called PlaySpent helps students understand the difficult choices made by patients related to the acquisition and expenditure of limited financial resources to meet everyday needs, while also educating them on the factors related to those choices. Examples of the types of choices a student may have to make are shown on this slide. In addition to making these difficult choices over 30 days, students are also challenged to not run out of the money that was initially allocated to them during the simulation.
The narrated slide presentation was developed to give learners a better understanding of various social determinants, including socioeconomic factors, the physical environment, health behaviors, and access to quality health care. The relative impact of those determinants on health outcomes for individuals and communities was addressed as well, recognizing that only 20% of health outcomes are related to a patient or community's access to the healthcare system or the quality of services they receive, while a whopping 80% of those outcomes are related to things like the physical environment, behavioral factors, and other social determinants as depicted on the slide. A key message in the webinar presentation is that all healthcare professionals do have a responsibility to first, actively listen to their patients and be attuned to discovering potential challenges they may be dealing with, and then 2, to act on what they've discovered and communicate with other members of the healthcare team to address the social determinants as appropriate. As seen on the slide, a sample scenario could deal with a sonographer who discovers that a patient has challenges with transportation. From a National Academy of Medicine report issued in 2019, a framework can help healthcare professionals think about how they can begin integrating various actions to address the social determinants of health. Using the example of transportation, i.e., for getting to and from appointments, this particular framework addresses awareness by encouraging professionals to ask questions related to the social determinants. It addresses adjustment by encouraging healthcare professionals to explore other options and approaches for providing care. Providing assistance could mean working with the patient when they need to connect with other resources that already exist in the community, such as transportation vouchers or assisting with setting up telehealth appointments through a smartphone. Alignment can be achieved when the healthcare unit actually invests its own resources and programs that already address transportation barriers. This may include a ride sharing opportunity. And then advocacy can come into play when healthcare providers actively advocate for improvements in the existing transportation infrastructure, including rideshare programs, municipal bus route schedules, and stops that can help patients get to and from their appointments. Learners were also introduced to various evidence-based tools that can be used to screen patients for issues related to the social determinants. And those included the Prepare tool from the National Association of Community Health Centers, a tool from the American Academy of Family Physicians, a screening tool from the Centers for Medicare and Medicaid Services, and a sample screening form that's being piloted by faculty here in the OU Health Science Center. Regarding the debrief and discussion questions, student organization operation leaders will be strongly encouraged to consistently facilitate structured debriefs using the discussion questions portrayed on the slide. And this will be done with support from supervising faculty as appropriate. So, in terms of lessons learned, it's essential that all healthcare professionals are taught and understand that the social determinants of health can have a significant impact on an individual's overall health and well-being. Secondly, not all healthcare professionals will be treating all diagnoses and symptoms, but any and all healthcare professionals can discover a patient who's having difficulty with a social determinant of health. And then finally, healthcare professionals can choose from multiple evidence-based frameworks, tools, and methods to address the social determinants of health that work best for their patients and in their clinic setting.